Hello, it's Kathleen again, and here we are at our last class of this wonderful 10 class series on breathwork and lymphatic wellness. So, as a lymphedema therapist, I am super excited to share this episode with you because I'm going to show you evidence-based journal articles on breathwork and complete decongestive therapy for lymphedema. So let's get right into the research. I'm a lymphedema therapist. I'm also board certified in therapeutic massage and body work. I'm a health coach and a yoga teacher. I have a certificate in spa and wellness management. I'm the author of Stress Reduction for Lymphedema, which is a book. It's available on Amazon, as well as Mindful Strategies for Adults with Adverse Childhood Experiences. Both of those books are available for you if you want to look more deeply into the research. They're both on Amazon. So what are we going to explore today? We're going to look about the benefits of something we're showing each and every one of our clients, diaphragmatic breathing, for both upper and lower extremity secondary lymphedema. So this is a great way to encourage them to do diaphragmatic breathing, not just on our table when they're doing the MLD, but as a daily part of their self-care. And we're also going to experience something called a deep resisted diaphragmatic exercise. So this is coming to us from literature. So as we always do, I'll invite us to start with a mindful moment. So just get settled in your chair, wherever you are, your couch, in a position that's respectful and attentive, comfortable, and just take a few moments, take a few breaths here, and focus on what you've gotten out of this 10 series so far, questions you might have about today's episode, things you might want to learn from today, and any questions that are just seeming really exciting to you about this wonderful topic. And then we'll continue with, as we do, with a minute of 5-5 breathing. So I will guide you in that. So go ahead and exhale and inhale and exhale. Inhale and exhale. Inhale and exhale. Inhale, exhale. Last inhale. And last exhale. Okay, we can return to breathing however normal is for you. And we'll start by doing those neck exercises. So as we inhale, we'll look up. And exhale, we'll look down. Inhale, looking up. Exhale, looking down. Last inhale, looking up. And exhale, looking down. Return to center. Inhale, look left. Exhale, looking right. Inhale to the left. Exhale to the right. Last inhale to the left. And last exhale to the right. Return to center, and then ear to the left shoulder, ear to the right shoulder, ear to the left, and ear to the right. Last time, ear to the left, and ear to the right. Great. And then our hands can go on our shoulders, and let's just do some slow shoulder rolls, shrugging the shoulders up, pulling them down. Extra credit if the elbows touch. And then go ahead and reverse to the other direction. And last time. All right. And then go ahead and shake that out, and hopefully we are ready to learn. So before we get into any actual breath work, before you do breath work, I would give you a caution. If you have anxiety, breathing problems, cardiovascular or blood pressure issues, I'll invite you to ask your physician if it's all right to do the breathwork exercises. Everyone can listen and learn, but if you're actually going to do the breathwork exercises and you think that you should talk to a physician before starting them, definitely talk. These videos are always going to be here. They'll still be here after you talk to your physician. And then even if you are cleared, if in the middle of any of these exercises you feel anxiety, lightheadedness, dizziness, rapid heartbeat, shortness of breath, it's just time to stop and take a break. Again, the video will be here if you want to continue it at a later time, or just stop the breathwork practice and wait for us to finish it, and then we'll get back into the research after that. And then always know, are you ready to have seated breath work? Usually that means you just count your breaths in 1 minute. So most people will breathe 12 to 20 times a minute. And then if you can comfortably breathe 2/3 of your regular amount of breathing, then you're ready to sit up and be seated. If you can't really comfortably sit and breathe slower than you usually breathe, it's completely fine. And in cases with people with lymphedema, it may even be better to actually lie down when you're doing this breathing, because that can actually let gravity work in your favor to help get this lymphatic fluid into the circulatory system. So there is no difference at all whether you're seated or whether you're lying down. It's not a matter of pride or ego or anything. And here's the studies that prove what I just mentioned. They have found that 30 minutes of diaphragmatic breathing in the supine position, lying down, effectively induced thoracic duct lymphatic drainage. And another study found abdominal respiration during a 30-minute rest in the supine position is effective at inducing lymphatic drainage and the associated induction of hemodilution, lowering of blood ADH concentration, and increased micturition, which is what we want. We want them to urinate. So it would be ideal if they felt uncomfortable with seated breathing. Don't stop breathing altogether. Don't think you're not the type of person that can do this breath work. Go ahead and lie down and take advantage of the gravitational effects of being in the supine position that will help your lymphatic system. So when and how do we practice pranayama if we're doing some serious breathing exercises? Ideally, you should have already your solid practice of yoga. You should start with an empty stomach, bowel, and bladder. So pee before you do the pranayama. And it's just, if you just ate, doing some intense breathing exercises is not going to be comfortable with a full stomach. So we completely understand that. And focus on nose breathing. If you can breathe through the nose and the practice wants you to breathe through the nose, it's ideal to breathe through the nose. So let's look at the effect of resisted deep breathing on post-mastectomy lymphedema. So this is 68 patients had post-mastectomy lymphedema, and they either had CDT alone or CDT plus breathing. So everyone had CDT. Some people did not have the breathing and some people did. They had 3 sessions a week for 4 weeks. And they found if you do the CDT plus have them do the breathing, significant improvement in deep resisted breathing, the breathing group in the axillary, mid-arm, elbow, mid-forearm, and wrist circumferential measurement of lymphedema in comparison to the control group. So this is really a great study to recommend breathing plus having CDT. So let's look at what this deep resisted diaphragmatic exercise is. So they had a small sandbag. These are giant sandbags, like there's going to be a flood, but it's a small sandbag or a small weight. It was only 0.5 kilogram for the first 2 weeks and it increased to 1 kilogram in the last 2 weeks. And they also, so they place that up over at the, between at the bottom of their ribs. So they put the sandbag, they lied flat, they put the sandbag towards the bottom of their ribs and their abdomen, and then they used a metronome to control the rate of breathing. So this is a 3 seconds or 6 second, 3 second, 3 second, 6 second, and we'll see it in the next slide, a specific time that they're breathing in and out, and they were able to use an application on their phone, an Android application that gave them auditory feedback to allow them to follow this specific breathing pattern. So the subject was asked to be in a supine position. Also, place one hand on rectus abdominis and inhale slowly and deeply through only the nose, inflating the abdomen without moving the top of the chest while relaxing the shoulders. So they first trained, this is how you breathe. You breathe, so when you inhale, you only feel it in the low hand that's on the rectus abdominis, not so much breathing up here in this area. And then when you exhale the air, it's pursed lips with your lips parted. So the exhale is like that. So the breath consisted of, like I mentioned before, 3-second inhalation, 3-second pause, 6-second exhalation. So they did 3-second inhalation, 3-second pause, 6-second inhalation, exhalation. And they continued that breathing for 20 minutes, again, with a little bit of the weight to remind them, right there over the costal cartilage, rectus abdominis, to remind them to breathe, and then also to give them something to inhale against with their diaphragm in this survey. So they also looked into resisted deep breathing in the pneumatic compression session. So if this is really great, if your client has a pump, a lymphedema pump, they could definitely do this while they're in their pneumatic compression session. And they looked at 5 minutes. So the session is longer for the pump than it was for the breathing. So they started the first 5 minutes after they got into the pump, not breathing exercises. The middle 20 minutes, they did do the breathing. And then the last 5 minutes, let go of the breathing and just let the pump finish its work on the body. And again, we saw the weight is 0.5 kilogram in the first 2 weeks, and then it increased to 1 kilogram in the last 2 weeks. It was positioned right above the diaphragm, where the diaphragm is, and they kind of tied it on with a strap in this study. So I love this because as we learned in earlier episodes of this class, the benefits of diaphragmatic breathing, the benefits of holding the breath, because this has a breath hold in the middle, and the benefits of pursed breathing. And we're going to put it all together. So I have my little image of the abacus where like everything's adding up now. Let's take some of these skills that we learned in this 10 session of class and see what happens in research when they're put together and used to help people with lymphedema. So let's go ahead and try it right now, and I will guide you on this. Again, we'll do 3 seconds of inhalation, 3 seconds of pause, and 6 seconds of exhalation, and we'll continue for 20 minutes. So I'll go ahead and have you exhale and inhale. Pause, exhale. Inhale, 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 pause, and 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 exhale. Inhale, exhale, pause, and exhale. Inhale, 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 pause, and exhale. Our last inhale, pause, and exhale. And we made it. That was 20 minutes of this type of breathing. So take a moment now, breathe normally, whatever's comfortable for you. Wiggle your fingers and toes, and I'll give you a moment to really feel inside yourself. How do you feel after doing that practice? And I'd love to hear your reactions to it. Definitely leave it in the comments of this YouTube video. And let's move on to looking at a different piece of research on the rehabilitation efficacy of diaphragmatic breathing combined with limb coordination training. So this is a machine for lower limb lymphedema following gynecologic cancer surgery. So yes, if anyone didn't know, lymphedema therapists definitely do know, you can get lymphedema after gynecological cancer. Gynecologic cancer surgeries or treatments, such as radiation and chemotherapy, can disrupt the normal lymphatic tissue, which results in inadequate transport capacity, accumulation of the interstitial fluid in subcutaneous tissue, and then we have the onset of lymphedema. So in this study, participants had either cervical, endometrial, ovarian, or fallopian tube cancer. And before starting their CDT treatment, they learned this breath training. They learned it lying supine, their knees were bent, and the therapists placed their hands on the patient's abdomen, offering resistance based on their ability to maintain the diaphragmatic breathing. And the patients were instructed to practice resistance diaphragmatic breathing while pursing their lips, inhaling through the nose, and then exhaling slowly as if we're all, leaning in and breathing out that candle. So again, the pursing of the lips. So in this study, the inhalation-exhalation ratio remained at 1:2. So that's, you'll see if you look, that's kind of the shorthand for breathwork practices. So it's for every 1 second you inhale, you're exhaling for 2 seconds. So this lets you get deeper into the practice while keeping the same ratio. So if you could inhale for 4 counts, you're exhaling for 8 counts. If you're inhaling for 5 counts, you're exhaling for 10 counts. So just all with that 1:2 ratio. Each group completed 5 breaths, and then they had 2 sets of that breathing exercise before their CDT treatment. So each of these training sessions lasts for about 10 minutes. And then let's look what happened. So they underwent diaphragmatic breathing. They also had this limb coordination training with something called a Loop Go limb coordination training device. The important part of the study to look at is they experienced notable reductions in scores for self-perceived symptom assessment questionnaire, as well as their bilateral lower limb circumference, as well as anxiety and depression scores were all better when they did the diaphragmatic breathing before the CDT, and then they also did this training device, which is, we all will say that exercise is a part of CDT. So that's a simple way to incorporate. It's not an unusual incorporation for exercise with the CDT. So the researchers concluded that diaphragmatic breathing exhibits superior effectiveness in treating lower limb lymphedema after gynecological cancer surgery compared to traditional CDT therapy. So definitely CDT therapy plus this diaphragmatic breathing is superior according to this study. So it's definitely something to focus on, to just give this extra tool in the toolbox of our clients with gynecological cancer, with really any type of cancer that are undergoing CDT. Really think about adding diaphragmatic breathing to their self-care while they're undergoing CDT therapy. All right, so thank you so much for staying with us through this breathing exercise. It was a long one in this class. We really got to see the effects of this breathing exercise that we tried on ourselves. And then the inspiration is, if you really liked it, like grab something that's a half a kilogram or a kilogram and try doing it again, supine, lying down with something over your diaphragm, and see if you can see the benefits of this practice in your own body. And that inspires us to share it with others, because we have that lived experience of doing it ourselves. So as we close this last class, very much gratitude to you for showing me that you are passionate about helping clients, that you're passionate about breathwork and lymphedema, that you're always willing to learn something new, that you want to join me on this 10-session experience of breathwork. Much gratitude to everyone who has joined me in this class. So let's end the classes with one last opportunity for a mindful moment, or just taking some nourishing breaths. feeling gratitude for ourselves, for stepping up and learning more in 2025, and bringing to mind everything that we've learned and everything that we still want to know, that we're still curious about. And come together one last time to join me in some 5-5 breathing. So we'll take 6 breaths, 5-second inhale, 5-second exhale. So we'll start with exhaling and then inhale and exhale. Inhale and exhale. Inhale and exhale. Inhale and exhale. Last inhale and last exhale. We can let that go and breathe normally. And if somehow you found this class first, or you want to review any of the other classes, you can find the full free 10-session breathwork and lymphatic wellness classes is at my YouTube channel at Stress Reduction for Lymphedema. That's the same title as my book. If you want to see more than just breathwork, you want to expand out to under things like how can acupuncture help, how can exercise help, how can yoga help, how should I make sure that yoga is safe for someone who has lymphedema. All those things are included in my book, Stress Reduction for Lymphedema, which is available on Amazon in paperback and Kindle. And all of these free videos are available on my YouTube channel. And here are the resources for today. And we are all done. So I will take this moment to thank you so much, and I hope to see you at a future conference. And if you have any questions, let me know in the comment section. If you want to tell me your experience with this breathwork practice or anything that you've seen, any other things that you do in addition to the MLD and the wrapping and CDT that you find are really helping your clients reduce their stress, make CDT more effective, please share it in the comments so we can all learn from your experience. Thank you and have a great day.